Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Clinical features of membranous glomerulonephritis. Clinical features of membranous glomerulonephritis are: first, the patient presents with the disease is insidious in onset, and the patient presents with weight gain and leg edema, which is slowly building over months. Urine analysis can be done, and in the urine analysis urine creatinine can be done, but it does not give idea about anything about this membranous glomerulonephritis, because in most of the cases urine creatinine is normal. In membranous glomerulonephritis, creatinine should be raised, but in most of the cases it is normal, so this does not give us any clue. Then, in the membranous glomerulonephritis, the other features are: there is um, renal insufficiency. In membranous glomerulonephritis, renal insufficiency can occur with patient develops hematuria, or abnormal urine sediment can develop in the patient. Then the patient can also develop renal vein thrombosis is common in these patients, but the complement levels are normal. And there is non-selective proteinuria. If you see the membranous glomerulonephritis, you will see selective proteinuria, that is, there is loss of only albumin occurs in the urine. But in membranous glomerulonephritis, there is non-selective proteinuria is seen, that is, along with albumins, globulins are also excreted in the urine. Then 75% of membranous glomerulonephritis shows nephrotic syndrome, whereas 25% of the cases shows subnephrotic syndrome. In this subnephrotic syndrome, one half of them might progress to the nephrotic syndrome, whereas the rest half will be left as subnephrotic syndrome only. So for the course of the disease, we have rule of three for membranous glomerulonephritis. According to this rule of three, one third of the patients will undergo spontaneous remission, one third of the patients will have proteinuria, but the patient will be stable, whereas one third of the patients will progress to end stage renal disease.
thank you and thank you for watching.